This is the Man Up Podcast, the doctor's guide to men's health. Each week on our podcast, we interview the top specialists of the field on various topics in men's health. You have questions that you are too afraid to ask? We have the answers. This week, our episode is titled, Why It's Important to Check Your Balls. I'm Dr. Kevin Chun. I'm joined as always with my co-host, Dr. Justin Dubin. What's up, Justin?
Kevin, how are you? Happy whatever day of the week you're listening to this, probably a Monday, I guess, because that's when we'll be posting it. Everything good over in Miami right now?
Yo, everything is great. How's everything going in Chicago?
Excellent. It's cold. It actually snowed, but it is also Movember still, as you can
important
see from
month.
this beautiful mustache that I'm growing here. Dr. Ritch has a goatee.
Yeah. This
well,
has been
Kevin.
going for 2 weeks. This is what I got going.
But with Movember, we already had talked about prostate cancer and screening in our last episode. So we thought it was very important to talk about another kind of cancer, testicular cancer.
Yes.
And talking about your balls. So Kevin, why don't you introduce our guest today?
Yeah, so we are very, very lucky today to have Dr. Chad Ritch, Associate Professor of Urology at the University of Miami. He was a great mentor to me and Justin, so we're glad to have him on the podcast today. How you doing, Dr. Ritch?
Awesome. Thank you guys for having me. It's a pleasure to be here, and it's really great to see this podcast doing so well. You guys have had some really good hits. I'm glad to be a part of it. Share some knowledge on men's health.
All right.
What little I know.
Come on, you're like a manly man. The guy's got biceps on biceps. We know it. We've seen it.
That's right.
Anyway, so yeah, exactly. Let's so let's get into it. Dr. Ritch, how common is testicular cancer? And what ages are the common ages that men get testicular cancer when we're talking about worrying about whether you have it or not?
Yeah, so thankfully in general, it's not very common when you look at, most of the other cancers that men can get. You always hear about prostate cancer and so on. But for testicular cancer, when it comes to ages, that's where it's important, is that so between the ages of 20 and 34, 20 and 40 years old, it is actually the most common cancer in young men. So that's where it gets a lot of attention, is in younger men, basically 20 to 40 years old. And if you look in the US every year, there's probably about 9,500 cases of testicular cancer diagnosed every year. So, not a huge number, but when you consider the population of men 20 to 40, it is the most common.
So are there any risk factors for testicular cancer?
Yeah, it's a great question. I mean, you always think about, what can you do to avoid getting these types of cancers? So testicular cancer, the only real risk factors right now that we've identified in research is family history. So if you're, father had a history of testicular cancer, you're more likely to get it. And then a condition called cryptorchidism. So a lot of viewers might be like, that sounds like a mouthful. What is that? Cryptorchidism.
Sounds like a ghost.
Exactly. Basically, it's undescended testes. And even that is like, everybody's like, what's an undescended testis? That doesn't even make sense. Well, believe it or not, when we're born, your testicles start up in your abdomen and they lower until you're at the right size and weight. And when you're born, both your testicles should be, in the scrotum, in the sac, if you will. So, for some unfortunate baby boys, it's not there. And one testicle may actually be higher up and still either in the groin area or in the abdomen. And when that happens, that is a risk factor. That's a known risk factor for testicular cancer. So, hopefully most people's parents would have told them about this when they were, little and growing up. But just in case you don't know, or if your family member was like, oh yeah, there was something weird with your testicles where it was not there, you should be thinking, okay, that's something I heard on this Man Up podcast, that maybe that's a risk factor for testicular cancer.
But the point is, though, it's important though to note for that is it doesn't have to be up. It could have been up and then surgically brought down, and it's still a risk factor, right? So
exactly.
That's your point, right?
Absolutely.
So, but if it is up there, that's even more of a risk factor, actually, potentially.
Correct.
It's a higher risk.
Correct.
So that's important to know. And I think that like a lot of us, I know personally, I have a lot of friends who have either told me, I guess we, as urologists, a lot of
we
people
naturally get these questions.
Things. Yeah. I've had it, like people are like, I had an undescended testicle. Does that mean anything? Or people I know who have have confided in me that their family members have had testicular cancer. So it actually comes up more often than you'd think, and something to definitely be aware of. So it's a great point.
Yeah, no, definitely.
So, now that we know this information about the risk factors and how common is it, so how often should men be checking their balls?
Every day, all day. No, I'm kidding.
I think
Every
they
minute,
are for
every
the most
minute.
part,
Yeah.
right?
Yeah. You mean for testicular cancer in general? No. So the truth is, at a minimum, we always tell people when you have a physical exam, so when you go to get checked up by your doctor, you should be checking every year, and they should examine your testicles. You should check your balls. But if you're going to do it, yourself, you know, at a minimum, I would say 2 to 3 times a year, but ideally you check it monthly because, especially if you have risk factors. So again, if you have family history or history of undecided testicle, you should probably be checking it every month. But, in general, 2 3 times a year, you probably are okay.
And so if I'm obviously we're doctors, we know how to check balls appropriately.
Yeah.
It's in the job description for us. But if you're at home and you want to do this exam on yourself, what's the best way to do it? And what are some signs that it may be normal, maybe abnormal?
Yeah. So I mean, the easiest time is when you're in the shower. Okay, so you're relaxed, you're showering, water's warm, your scrotum is relaxed. You can actually get a feel of things pretty good. Probably not the best time to check it if you're living in Chicago, like Justin, you are in the sub-zero
right?
weather when you've just come home from being outside. Probably gonna be hard to check it. So you want to check it when it's nice and relaxed, warm. You can basically you get the testicle between the thumb and forefinger, and you gently roll in between. And what you're looking for is something that's hard, actually, like a pebble, almost like like a rock that you can feel. A lot of my patients will come, with a concern about testicular cancer, and they say, "Oh, I felt something weird," and you examine them, and there's a whole list of things that men can feel that are not actually testicular cancer. So, like you will feel there's a cap on top of the testicle called the epididymis, and it transports sperm. You'll feel that it's kind of like a very, soft, pliable lump, if you will. That's a normal thing. That's not like a tumor, but a lot of men feel it and they think that that's something abnormal. So that's usually just the epididymis. Then sometimes people actually have things like ingrown hairs and they're worried and they feel like in the actual skin. So a big difference is that this is in the testicle itself. Now, separate and aside, yes, you can have tumors that arise outside of the testicle, which is very, very rare, but testicular tumors arise in the testicle. So the thing you're feeling for is, again, a hard lump within the testicle itself that should be soft and squishy. Sometimes people can have fluid around the testicle. And while that may not be testicular cancer, sometimes it can actually be a reactive thing that can be an early sign of testicular cancer. So that's something that should prompt a checkup with a physician as well.
So
basically, I just want to summarize that for a second.
Yeah, sure. Right? Yeah.
So basically, you do an exam when you can, warm water, finger between your thumb and your pointer finger, and your testicle between your thumb and your pointer finger.
Right.
Warm weather. Anything hard, abnormal inside the testicle, you want to go talk to your doctor. Obviously, there's some other things that you may feel. Your testicle maybe is filled with, there's a fluid sac around it that you can't even grab your testicle. That's still worth going and talking to your doctor about. Is that correct? Yeah. All right.
And so, let's say, Dr. Ritch, I go to the doctor and they take a touch of it and they're like, yeah, this is something worrisome. What's next? What should I expect?
So the thing you got to look out for is, let's say you get the exam and it's abnormal, you feel something hard. Now you want to go to a physician and you need to get a test to get checked. So the best test is usually an ultrasound. A scrotal ultrasound is what we typically do. So that actually gives you, anatomic information about what's there. You will actually see a lump, or you may see some abnormal blood flow in a particular area. There's other tests you can get, but these would be kind of premature. You don't want to check this stuff until you have the scrotal ultrasound as the first thing. And obviously a physical exam. So the doctor is going to physically confirm what's there before they get an ultrasound. So, there's blood tests that you can actually get for testicular cancer. They're called tumor markers, AFP, HCG, LDH. They're just acronyms for specific markers that are produced from some of these tumors. But you, again, would not get those markers. Your first step would be a physical exam and then getting an ultrasound from a physician.
Awesome. Okay, so for unfortunate reasons, someone gets the ultrasound, they get the exam, and their markers are back, they're positive, and you're really concerned of testicular cancer. Like, what's the next steps? How do we treat testicular cancer? And I know this could be a long answer, but give us like a general summary.
Yeah. So, I mean, basically, the majority of testicular cancers are very curable, and most of them, the only treatment you need is a procedure called an orchiectomy. That's basically where you remove the testicle. Now, everybody be like, well, I don't want to remove my testicle. That sounds crazy. I just take a part of it and leave the rest inside. But, unfortunately, you want a complete resection if there is testicular cancer there. The surgery itself takes probably about an hour, and it's an incision that's in the groin, and the entire testicle is removed and sent off for analysis. And that's how you confirm that there's testicular cancer. Now, fortunately, over probably about 95% of patients will be cured from that alone. So, it's essentially orchiectomy, cure, and then you're on surveillance. So there's usually no chemo or other additional surgeries involved. And like with every other cancer, yes, they're very rare advanced cases, and you may need chemo or bigger surgeries and these things, but that is by far the least common outcome for testicular cancer. So again, it's a testicle removal, orchiectomy, and observation.
All right, so it's good news. That's important for our listeners. Look, you detect it, you really check your balls often. If you catch it, if you happen to be unfortunate, able to catch it early on, there's a treatment for it, and fairly good survival rates from it. And also, for our listeners, there's also the option of getting a prosthesis placed, which we've done with Dr. Ritch, so aesthetically and cosmetically, it'll still look like, it was before.
Yeah. And it feels like it too. We can confirm that as well.
Yeah. It's, you explain to patients, it's very similar to women who have breast implants. It's a saline implant, and it's meant to feel natural. The interesting thing is with men, the first thing they always ask when you're telling them, listen, I'm going to put a prosthesis in, and they're like, well, what size are you going to use? And of course, it's natural. Well, what size do you want? Nobody wants a smaller one, or maybe they do. But it can be sized appropriately to match as closely as possible to your, other ball.
There you go. We're here to cosmetically please as well.
Absolutely.
That's right.
All right. So you told us about the survival rates and the treatment options. But the one thing, Kevin and I, obviously, we're fertility guys. The one question really is, should we worry about fertility? Are men with one testicle, should they be banking before they have the surgery? Should they be banking before they have treatment? What are the options here, and what do you usually recommend?
Yeah, well, as you guys know, I mean, I always advocate for sperm banking before this procedure, right? Because again, this can lead to other paths of treatment, where that may affect your fertility in the future. Right. So when we say sperm banking, we're also thinking about the future, not just today. So even if your other testicle is working perfectly fine, your sperm quality is great, which thankfully most men, even with the one testicle, will be pretty good still. You have to think about, what if you need chemotherapy, or what if you need radiation? How is that going to affect your fertility? So absolutely, everybody should consider sperm banking before undergoing their orchiectomy or their treatment. And there's a few patients who unfortunately may miss the boat for the sperm banking, and they have the orchiectomy done first. They can still do it afterwards, with the normal contralateral testis, right? So they should be able to do that again in the event that they need some other treatment. And then, the other thing is testosterone production. You guys are the gurus at this, but as you know, a lot of men are concerned about having low testosterone. So I will also check a testosterone sometimes, just to set a baseline and then see what it is afterwards. and then send them to one of you guys as an expert to discuss it if it turns out that when we remove that testicle, it's low.
Yeah, absolutely. Everything that you said is we 100% agree with. I think the reassuring thing about testicles is you do have two of them, right? So, most of the time, having one testicle removed should not compromise your fertility. It should not compromise your testosterone levels. But the one issue is that, cancer itself can have this pathological inflammatory process within the body, which can temporarily at least potentially compromise your fertility and your semen parameters. So obviously, the sooner you have an opportunity to evaluate your semen concentrations and your sperm, that if you need to bank, obviously the better. But, like you said, typically it's not an issue unless you have to move on to something more invasive, chemotherapy, bigger surgeries. I don't know. Kev, any other questions?
No, I think we got a lot of good information here. Justin, me and you, we look at the numbers from our show. We know a lot of our listeners are between the ages of 20 and 40 years old. So this is important stuff. Check your balls,
That's right. Check your balls.
In warm, warm showers.
First off, right. I mean, who's taking a cold shower? It's just terrible.
Hey, no judgments around here, Justin.
All right. So thanks again a lot, Dr. Ritch. This was really great.
Yeah.
Learned a lot. And like we said, this is very important information for 20 to 40-year-old men to really know, especially in November, Men's Health Month. So thanks for coming on. And I'm sure we'll definitely have you on to talk about some other topics in the future.
Anytime.
Awesome.
My pleasure.
For all our listeners, thanks for listening. As always, you can find us, download us on all podcasting apps, including Spotify, iTunes. You can also listen to us on and watch us on YouTube. So feel free to subscribe to that. We're also on Instagram, Twitter, and now TikTok. So follow us on all the platforms. If you have any questions, comments, please feel free to reach out to Kevin or I on our social media platforms. Otherwise, from Kevin and Dr. Ritch, thanks for listening. Until next time, have a good one.
Take care.